Welcome to the Fraud, Waste, and Abuse webinar. I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter today. Today, I'm joined by Aline Ziegler from our team, and she will help with technical problems. She's going to monitor for chat and the questions in the chat, all those different types of things. One of the things that we looked at when we decided to do this webinar is what questions you had, what can we get you for information? So much of the slide deck is actually built based on those questions and information we've gathered. We did previously offer this course a year and a half ago, and so we've looked at the surveys from that course to also see if we needed to supplement any of the information. Okay. So with that said, this will be posted as an encore as well. But let's do a little housekeeping just for the webinar itself. First of all, if you would like the presentation, please go to our training center. This is under live events, and you can download the presentation today. You can use this presentation to follow along, especially if you're calling in and you're unable to join via the phone or you're having any difficulties. The presentation may be helpful. I do want to let you know it is not a required item, though. The presentation is not required. Now, want to make you aware that what we're going to do is post this presentation or the recording onto YouTube as a YouTube video and the encore videos. What we will do then is post that for 60 to 90 days on our website. What'll happen is the presentation, the actual PowerPoint will be loaded with that encore as well. So if you don't get it today, we're probably going to take it down either this afternoon or tomorrow morning, but you can always wait until we post that. Typically, posting takes a couple of weeks. With the holidays, of course, please allow up to a month. It's a little bit different when we get some time frames and you get some time off thrown in there, all right? I do want to remind you that we will take questions from you, and I do have multiple points built in. I have taken questions, but if you have them, please add them to the chat. As time permits and as I get to these different sections, it really does help me understand what you're looking for. After this event, CMS has asked us to give you a survey on everything that we do. So we're going to give you that survey. We really do use this feedback. Not only does WPS use it, but so does CMS. So the feedback's very important. A couple of things to keep in mind when you're doing this survey. Be honest. Tell me the good, what I did well, the bad, what I need to improve on, or what you thought I could have done better, and maybe the ugly. I'm gonna call that my PowerPoint. So you'll hear me use that a few different times. The good, the bad, and the ugly. How did everything flow together? Did you like the resources? Because I'm going to show you some things on the website as well, time permitting. So please be aware of all of those types of things. To give you a quick disclaimer before we move on. Now, fraud, waste, and abuse is something that is defined very clearly. However, the rules that make it up can change because Medicare does go through changes. And as those changes occur, this directly affects fraud, waste, and abuse because you must follow the current regulations or the regulation that is in effect for the time, for the date of service. So it's a very different possibility when we talk about fraud, waste, and abuse, and we talk about some of the things that you'll need to be aware of. The answers that I will give today are based on the questions that you ask and the information within that question. Because changes occur, this means the answers may also need to change tomorrow or even later today. My favorite story that goes with that was I was actually teaching an in-person class. I got a phone call saying, hey, have you taught this part of the class yet? I was like, no, that's after lunch. And then at my lunch, I had to review the changes that came out from CMS, and we had to actually present on that after lunch while talking about that. So changes can occur, and Medicare does change frequently. The most current information will always be on the CMS website, and that's cms.gov, and you can access that directly in the link on the slide. A couple of things about making sure that you follow that. The CMS website does have the official information. We do offer guidance on our website. That's wpsgha.com, and our website does contain guidance. So anytime you're looking for which one will override the other, it's the information on CMS that will override the WPS website. First question of the pre-submitted questions answered. Let me know if you still have questions on that. If you are recording, we do ask that you stop recording. We will, again, post this as an encore presentation. I'm going to post it into our YouTube channel. We will link to it from our website. You'll have 60 to 90 days for our website to download the, again, handout material, which is the PowerPoint presentation. All right, let's get started with the real topic for today. Medicare, fraud, waste, and abuse. What is my goal? My goal is to help you understand what fraud, waste, and abuse is. We really want to define all three of them because by combating each one individually or together, we can save billions of dollars annually. We'll talk a little bit more about that. So again, I'm going to define them. I was asked specifically to include the federal laws that safeguard Medicare, so we are going to do that. Then I was asked specifically for who you could expect to see as players. Now, the word players was interesting to me because I wasn't sure if they were talking about contractors, federal, maybe prosecution, maybe law enforcement. I wasn't really sure who they were talking about, so I built a section to cover that as best I can. I will, however, warn you that if I don't get to some of those players or you have questions on ones that I didn't answer about, please feel free to get to that. One of the questions that we got, and I do want to start right here on the agenda with this one, and before we even get into definitions, is why does CMS focus on fraud, waste, and abuse? And the answer is it's a big business, especially fraud. Medicare fraud is becoming more and more. And so they're working different mechanisms and schemes to get money. Now, who are they? These are people that are billing for intentional monies that they aren't owed. Currently, it is estimated that approximately $60 billion annually are spent through this. Exact figures are impossible to measure because while we catch a portion of it, we don't catch it all. And we being the bigger government, the Medicare, a portion is caught. And that's why Medicare relies on people like you. So thanks for attending, and we hope that you'll get something out of this. So fraud, waste, and abuse is a major concern because it's an overutilization of services and increases the cost for the payers. It's called corruption of medical decision making, and it can lead to unfair competition in the marketplace. It puts a strain on that healthcare money that we all rely on for certain types of healthcare for the elderly or things that we've paid into, right? Medicare is not a free program in terms of someone has to pay for it. How do we pay for it? How many of you guys have heard of the Federal Insurance Contributions Act, FICA? That's how you're paying for it. Also, along with that, you do contribute to the Part B premiums. So there's another way in which you're paying for it. So someone's actually taking that money that you're paying away. And that's why we look at fraud, waste, and abuse. The government has found that for every single dollar spent on fighting fraud, waste, and abuse, it is approximately $8.10 in return, which means it's 8 times the return. So that is a very cost-effective way. Now, again, it doesn't mean that we're getting it all back because remember, $60 billion annually is the estimated figure. Okay. Now, in 2020, despite the pandemic, the Department of Justice obtained more than $2.2 billion back in settlements and judgments from civil cases involving fraud, waste, and abuse false claims against the government. Of that, 1.8 billion reflects federal losses. So the Department of Justice was able to return many of the Medicare trust funds and pay for legitimate care. Now remember, that's in 2020, where some of the stuff wasn't prosecuted and there was different issues going on. We all know what 2020 meant for us and COVID and all the different things that affected there. But I thought it was an interesting statistic because during that time, we were still fighting fraud, waste, and abuse. All right, so those are some statistics and why we're doing this webinar and why we're doing all those basics. So let's go ahead and move on. First thing I do want to do is provide a definition. I did have a few people who, in particular, we had 2 people who are brand new to Medicare and they don't really understand the difference between fraud and abuse, and then throw in waste and they were like, I'm completely missing something. So I did think that this section might help them, maybe knowing a little bit, but I also think it's great to review this for everyone. So that's what we're going to do. So first, fraud, and I want you to notice there are 2 words on this slide that are bolded. Okay, knowing and willfully. We'll talk about those. Fraud is defined as intentional deception or intentional misrepresentation that a person makes to gain a benefit from which the person is not entitled. Does it have to necessarily be a financial benefit? No, there are other types of benefits, and we'll talk about some of those. The key word is fraud, knowing and willingly executing or attempting to execute a scheme to defraud any healthcare program. Now, remember, when we say healthcare program, we are here to talk about Medicare, but Medicare is one of the federal programs. There is Medicaid, there is VA or Veterans Administration, State Children's Health. So there's a variety of other ones that all fall into this. So we really want to While focusing on Medicare, keep in mind that the federal programs are a lot more, and I'll talk more about those. Anyone, doesn't matter, anyone can commit fraud. If you know you're doing wrong, you are committing fraud. Now, it does commonly start as abuse. I didn't know I was doing wrong. But once you've been told you're doing wrong and you continue to do that action, now you are committing fraud. So one of the questions we had is, what is more common, fraud, waste, or abuse? The most common form is actually abuse, followed by waste, and then moving to fraud. Because remember, once you know, it's a different situation, because that's part of the key, knowing and willfully doing. Okay. So, what are some common examples of fraud? Well, first, submitting false claims, claims you have no right to be entitled or billed for. Paying or receiving compensation for referrals. Paying or receiving compensation for referrals. Did everyone catch that? You're getting a referral. Why are you getting that referral? Because you're paying the provider to refer that person to you versus who's the best provider or versus who the patient wants. You're actually paying for that compensation. You're making prohibited referrals. Okay, Medicare only covers for certain circumstances, making sure they're medically necessary, all those types of things. So you're making referrals for other things so that things will get paid. You know it's wrong. You know the patient doesn't necessarily need it, but you're still doing it. That's fraud. Let's move on because we were asked for a list or some form of a list of some specific examples, fraud examples, and what is considered fraud by Medicare. Billing for appointments the patient did not keep. To Medicare, the patient didn't keep it, you had no service, so why are you billing Medicare for an appointment the patient didn't keep? How are you assigning something to that? A procedure code would be the something, a diagnosis code would be the something, right? You didn't see the patient, so you're billing Medicare, but you didn't actually get that. Billing for services at a higher level than supplied. Now, this sometimes gets a little bit debatable because you say, well, I interpreted it this way and I interpret it this way. That's not necessarily fraud. That could be abuse. Now, if you know for a fact that you're always going to bill a 99214, which, by the way, I had a professional say to me that every service they do is a 99214 established patient E&M at the highest level, office visit. Well, Medicare would say, that sounds a little weird. Doesn't sound quite right. They knew what they were doing. They knew that they were not actually providing that service, but what they were doing were carrying notes over to make it look like that. They knew that it wasn't necessarily there. That's fraud. Billing for services not supplied. This one's quite simply, you didn't do it, but you billed for it. Now, lots of different things fall into this and a lot of different things go with this. A lot of times this is one that the patient will catch because they'll say from their remit notice that they get, from their summary notice that they get, they'll say, I didn't have that. I don't know who this provider is. So the patient actually says, I never had this. I don't even know who this provider is. Sometimes they report it wrong, right? I'm going to give you an example. How many of you had a patient say, I've never seen this provider, but you read a test or an x-ray for them? So they didn't actually physically see you, but you did perform a professional service. So sometimes they get it wrong. But if you didn't actually provide a service and you billed for it, that's definitely fraud. And again, paying for referrals for federal healthcare program patients. Don't do this. Fraud is definitely an illegal item, and it is definitely something that is subject to civil or criminal penalties. It can also get you barred from billing any of the federal government programs. Even if you're committing just Medicare fraud, it can get you from any federal government program. Again, we'll define that in just a little bit. The next question, and why is abuse looked at differently than fraud? And the key thing to remember with abuse is that it's not intentional. You didn't knowingly do it. You didn't knowingly misrepresent the facts. Sometimes abuse occurs when you don't even know you're doing it. So it's payment for an item or service when there is no legitimate entitlement, but at the same time, you didn't know you were doing wrong. You're billing it thinking you're doing the right thing. Abuse can be and is sometimes just as costly, if not more costly than fraud, because it's unintentional. It's unnecessary. You don't really know. Okay. Abuse includes any practice that does not provide patients with medically necessary services or meets professionally recognized standards of care. So let me give you an example here, and we'll talk more about this as we go through. But one of the things that came up, one of the questions that was asked is, we always run a lab work, but we always have certain items that go with that lab work because that's in our standing orders. Medicare would call that potentially abusive. Because if you always do something, why are you doing it for that patient? What is the medical need for that patient today? And can you define that? If you cannot tell me what the medical need is to do that, and you're always doing it, you're abusing the system. You didn't know you were doing wrong. You thought, hey, I'm doing great patient care. I'm making sure they get the extra step, making sure they don't have to get more lab work done. Maybe we're going to use this quality care, etc. It's all abusive stuff because you didn't know you were doing wrong. Now, if you knew you were doing it to get that extra money and you knew it was wrong, then that would become fraud. Okay. So this includes practices resulting in any unnecessary program costs, and that's what we just described. Any practice that's inconsistent with program standards, and we'll give you a few examples of those in a little while. So abuse, again, can be just as costly, sometimes more costly than fraud. However, there's generally no malice. It's not done, for that purpose. It's just, oh, I didn't know, or I thought I was giving great care. I thought I was doing a bit more. Now, remember, the Social Security Act, actually Section 1862 A1A, states that everything has to be medically necessary, barring any other portions of the Social Security Act. And there's a lot of other areas that fall within that, but basically we do look for medical necessity. And when you're using something outside of medical necessity, that's what we're looking for. Move on to a few examples of abuse. Whoops. Misusing coding on a claim. This is actually the biggest abuse situation. And it's where, as an example, they resonate there. This may resonate with some of you guys. You think about the different levels of physical therapy evaluation. So 97161, 162, and 163. Each one has different components that must be met. Let me give you an example. Example, 97161 requires no personal factors or comorbidities, but 97163 requires 3 or more to be present. There are different factors that must be addressed, such as an exam of the body system and clinical presentation. Then there's the component of time, but that component is not an exact time that must be met. It's more of a typical amount of time. So a typical amount of time for a 97161 is about 20 minutes. For a 97163, it's about 45. So let's say you do an evaluation that has no personal factors or comorbidities when reviewing the body system. You're also only addressing 1 to 2 elements. The patient is generally stable and requires a low level of complexity to make your clinical decision about this patient. However, the evaluation did take 45 minutes to complete because the family kept interrupting. Other people kept talking about their thoughts and the patient's need. Can you build a 97163? Again, the time factor is met, but not because it was medically necessary, but because other people kept interrupting. So no, you can't build that higher level code. You have to build a lower level code that actually meets the comorbidities, the time spent in actual medical information. So there's a big difference there, and that would just be an example. You can charge excessively. Billing not medically necessary services. Again, you didn't know you were doing anything wrong and you're billing Medicare for it, even though it doesn't meet medical necessity. In some cases, Medicare will even deny these services and make them the provider responsibility. Another one that we commonly see here is unbundling. Now, unbundling simply means you're billing service components instead of an all-inclusive procedure, or you're billing Medicare for something that should have been billed to another entity. What does that one mean for unbundling? Well, under the Medicare fee schedules and under the Medicare payment methodologies, if the patient is inpatient, all of the services go there with the exception of like the professional service. So the actual physician seeing them. When we look at those bundling services, labs, x-rays, etc., because they're billed to, let's just say they're inpatient in a hospital, you bill the hospital incorporates it onto their claim, the hospital reimburses you, and Medicare reimburses the hospital. Whew. But if you bill Medicare directly, before that inpatient claim comes in, we're going to reimburse you. Then what's going to happen is the inpatient claim comes in, we're going to take our money back. That's a form of abuse because you increased the cost to Medicare. So hopefully all of that makes sense as we go on. Waste is the next one. Now, waste is a little bit different. Waste is defined as an overutilization resulting in unnecessary cost to the Medicare program. These can be direct or indirect results of unnecessary cost to a healthcare system, not generally considered to be caused by criminally neglect or anything like that, but instead by payment errors, misuse of resources. A lot of times we actually see these more as an efficient management practice or control than anything else. But Waste is probably the most common form. If you start with waste, I know I said abuse before, but waste is probably the most common form. And again, waste is more common because it's just something that you simply do. You didn't really have an understanding. It's a misrepresentation, not meant to be fraudulent, not meant to be abusive, not meant to be anything like that. It's just you didn't know it was wrong. So also, it is just doing your practices. So someone asked for examples of waste. So here are just a few things. Doing a more expensive procedure or service than needed that would be covered or better outcome with a less expensive or procedure. So again, here you're spending more money than you need to spend to get something done when something could have been done cheaper. This is a form of waste. Not trying to avoid complications and declines in functionality, ordering unnecessary tests to guard against your own liability, continuing services that are no longer medically necessary just to educate a family at the end of an episode of care. This can be our most costly portion of it. And so we want to make sure we're doing that. Also, simply, putting the wrong amount on a claim. So you didn't mean to do it. You just typed it wrong. You miskeyed. You did other things. Some people refer to this as our fat fingering amounts. This is also a common example of waste. Again, you didn't really intend to do it, right? It's not what you meant. So we want to make sure that you're well aware of what fraud, waste, and abuse are. I will go ahead and move on because the next thing we're going to get some questions. Oops. Okay, so I will let you know that I would like you to put questions in the chat if you have them, and I'll check with Aline in just a few moments. What I'm going to do in the meantime, though, is just look at a couple of pre-submitted questions, okay? The first pre-submitted question I'd like to address is how to look out for Medicare fraud. First of all, thank you. Thank you for attending this webinar because you've completed step 1 for looking for Medicare fraud. If you don't understand what fraud, waste, and abuse are, how can you look out for it? Step number 2, look at the practices that you or your provider do. See if you can find anything that could be consequential. Meaning, do you know you're doing something wrong? Are you doing something wrong but you didn't really know it? And so you're trying to figure that out. And that could be something like overutilization or coding something that's not medically necessary. So remember, most people do commit waste or abuse versus fraud very intentional. But we still do encourage everyone to do self-auditing, to check for different practices, develop some kind of compliance audit. Those are your best steps to starting. Just develop some kind of compliance audit. During that, though, make sure the person is well aware to check the CMS website and where those current rules and regulations are at. Next question, what is the most common source of identifying Medicare fraud? Fraud is most oftenly identified by providers or their representatives or the patient. Those are the kind of 2 representatives. I'm going to use the word provider and patient here. Why? Well, providers sometimes you find it when other providers are giving referrals or they're not seeing referrals coming from specific areas, and so they report that. That's a form of fraud. Also, there are times when the fraud is identified as someone within their billing agency, someone within their own organization who says, wait a minute, why are you doing this? And the person says, well, because I want this money. I don't care what they say, just do it. That's a form of fraud. They know they're doing it wrong. Second, the patient identifies it frequently. And this actually happens again through that summary notice. They see things that don't make sense, or they're getting billed for things that they don't understand. And so then they send appeals, they send in notices to us. We actually can investigate a little bit. They can refer to other investigative agencies, which we'll get to in the 3rd section today. So there's a lot. Again, there was a couple of questions submitted and how much Medicare actually loses to fraud, waste, and abuse. There is no set dollar amount because we don't know. We don't know all of the forms of it. We don't know all of the dollars that affect it. What we do know is that it's estimated to be $60 billion annually. That's a lot of money that could be given for legitimate healthcare. What's the most common fraud, waste, or abuse? Again, as we said, abuse is most common. Waste is most common, followed by abuse, lastly fraud. And in most cases, once someone is doing waste or abuse and they're educated, we actually do see them stop. We don't see a lot of the fraud moving forward, but the fraud that we do see is very expensive. And we do begin some of the investigations, and then we can refer on to other agencies, and we'll talk again more about those agencies and other areas within section 3. So with that, I'd like to stop for a second and just see if Aline has any questions in the chat.
We don't have any questions yet.
Okay, let's move on then. I was asked for an explanation of the different laws Now, I will explain them at a higher level, probably than some of you would like. If you want more explanation, ask questions, we'll get through those. Some of you may just want that high level overview. The person that actually, two of the people that asked that were very new to Medicare and they really didn't understand the law. So I thought, okay, it's a great place to start. So what are we going to look at? We're going to talk about the False Claims Act, or FCA, the Anti-Kickback Statute, AKS, the Physician Self-Referral Law, also known as the Stark Law, the Social Security Act, SSA, which includes exclusion state and civil monetary penalties laws, or CMPL. We'll also talk about some of the United States criminal codes. So these laws are not specific to one part of Medicare. In most cases, the laws actually look at Part A, Part B, Part C, and Part D and help us combat all of those. So it's anything under the Medicare and Medicaid program related, under the Centers for Medicare and Medicaid relating to the Medicare program. So lots of stuff going on there. Let's go ahead and get started. And as I said, the first one is the False Claims Act. Okay. So this act imposes a liability on any person that submits a claim to the federal government that they know or should have known was false. Now, someone asked, when you use the term should have known, what does that mean? There are websites out there to help you. Remember, I talked about cms.gov. This is the official website for providers and for claims processors and all of that. It's the official Medicare website. Now, it is not the official one for patients. That's medicare.gov. It's a little bit differently there. But any information on cms.gov, the provider is responsible for knowing or having someone help them understand. You can imagine that is just tons of information. But because of that, it is publicly available information. Therefore, it should have known. Now, again, once you do know and once you've been educated, and we do track that, then it becomes a I did know, but I didn't follow it, a difference, okay? So when you look at examples of this one, it's submitting for services not provided, falsifying medical records. You'll hear us talk about medical records a lot. And sometimes the medical records do not accurately reflect the service or are adjusted to fit times to get a higher level of care or a higher level of code, which would be more money. So it just really depends. False Claims Act does not look at the intent to defraud, just knowingly committing it. Knowledge of deliberate ignorance, or reckless regard for the truth or falsifying of information is key for this definition under the False Claims Act. And I just realized that I forgot a comma after deliberate ignorance on your slide. There should be a comma there. Okay. So when we really look at this, that's what we're looking at. So here's an example, because someone did ask for that. This includes falsifying medical records. For example, saying that a patient was partaking in one-on-one therapy services while the patient was actually in therapy in a group setting. This is a difference in how you bill it. Also saying that a patient entered the therapy area at 9 a.m. and was there until 10:30. However, due to their condition, they were actively completing one-on-one therapy for 30 minutes while taking breaks in between and not actively within their therapy limits. Okay. So you bill dependingly. Again, it wasn't specific, or it wasn't that they didn't understand. It's really about making sure they're doing what they need to do. So with the False Claims Act, remember, if it's publicly available, who has to know it? Who's ever getting paid by Medicare for it? They should know, and they should or have someone work with them. If you falsify part of this, what are your results? 3 times the program losses, plus $22,000 per claim filed. Now, that sounds like a lot of money, and it can relate to a lot of money because 3 times the program losses, some of those losses are relatively minor, but other ones can be relatively large. It really just depends on what you're doing there. There's also a whistleblower provision, and that allows for individuals, staff, patients, providers to file a lawsuit on behalf of the U.S. and share in a percentage of the proceeds. So they actually do get some of the money, and there's nothing wrong with that. The federal contribution provides protection for these whistleblowers. We want to make sure that they are not discharged, demoted, suspended, threatened, harassed, basically any action taken against them. We want to protect them as well. So there are provisions within that. Now, it also says that your criminal penalties, should you be found guilty, should anyone be found guilty of this, are actually going to be imprisonment and fines, or fines. It doesn't say and, it says it can be or. And this is really going to be based on what you've done in a variety of different things. Let's go ahead and move on from this one. Talk about the anti-kickback status. A kickback is knowingly or willfully offer, paying, or soliciting or receiving any money paid for work or services directly or indirectly to reduce or reward patient referrals or the generation of businesses involving an item or service reimbursed by a federal healthcare program. What does that mean? You got money, you got something, because it doesn't have to be just money. There are other things that can be given. Trips are an example. And so you're getting that for knowingly sending someone there. So we're putting money in your pocket. Okay. Anti-kickback status. Anti-kickback statutes is a criminal law that prohibits anyone from knowing or willfully receiving a form of payment or compensation for this. It is covering Medicare or Medicaid. It also forbids payment in return for purchasing, leasing, ordering any goods, facility, service, or items that may be paid for by Medicare or Medicaid. So this is just basically making sure that you're following the rules, that you aren't ordering or referring, and that you aren't getting money back for any of that. Now, things that some people don't necessarily understand and fall under kickback: free rent. You can work, you can use our facilities, you can use my staff. All you have to do is refer your people to me. That's part of it. Okay. So there's a lot going on. Why does this statute exist? Kickbacks can distort medical decision making. They can cause overutilization, increase costs, and result in unfair competition by freezing out competitors who are unwilling to pay or receive kickbacks. They may also raise the cost of doing business for Medicare or for the provider. The statute was created to counter these potential abuses in the healthcare program. So when we look at the anti-kickback statutes, what are the results? Well, again, criminal penalties and administrative sanctions for violating the anti-kickbacks includes fine, imprisonment, and exclusion. Did you guys catch that? Exclusion from participation in federal healthcare programs. Now, it doesn't have to be all of those. It could be one of those. So it could be just an exclusion. It can be a temporary exclusion or a permanent exclusion. Keep in mind, I did not just say Medicare. I said all federal healthcare programs. So civil penalties can be up to $50,000 per kickback plus 3 times the amount of the remuneration. There are some safe harbors that exist to protect certain payment and business practices that would otherwise implicate the anti-kickback status, so some of them would be exempt. An arrangement must satisfy all of the requirements to be honored under a safe harbor. So again, lots going on with that particular result. Remember, the anti-kickbacks were designed to help keep the Medicare, or to help keep the medical field even, worthwhile, and all working together. The physician self-referral law. This is commonly referred to as the Stark Law, or I've heard it commonly referred to as the Stark Law. Prohibits physicians referrals of designated health services for Medicare and Medicaid patients if the physician or an immediate family member has a financial relationship with an entity, unless an exception applies. So basically, it's referring to yourself or to someone else within your family that has a financial interest, which could be ownership, investment interest, compensation agreements, all of those types of things. So you're actually making money for yourself. Financial relationships do include ownership. Again, that's the big one. The law actually lists 12 designated health services and includes PT as one of those services, just as an example. For an example, the orthopedic office provides a list of PT offices in the area. Again, orthopedic and PT offices. The practice that is part of this ortho office can be included, but is not the only one on the list. That's great. That's what you want to do. Now, if you said you must go to this PT office and it's the only one on the list, guess what? That is problematic. So as I said, there are 12 items included on here. One of those, I'll read through the 12 items. I'm just going to quickly read them. 1, clinical laboratory services. 2, physical therapy services. 3, occupational therapy services. 4, outpatient speech language pathology service. 5, radiology and certain other imaging services. 6, radiation therapy services and supplies. 7, durable medical equipment services and supplies. Paternal and maternal nutrition equipment and supplies. prosthetics, orthotics, and prosthetic devices and supplies, home health services, outpatient prescription drugs, inpatient and outpatient hospital services. So when you're looking at any of those, and again, you can look up the full list and you can get that out. If you just simply Google Stark laws or self-referral law, either one, it'll bring up that list for you. So what happens if you do this? Well, you can be fined. You can be excluded. Again, exclusions from participation in the federal healthcare programs. Remember, again, I keep saying this, federal healthcare programs is more than Medicare. It could be Medicare, Medicaid, TRICARE, Veterans or VA program. So when all of this happens, you can get a variety of different things that happen. There is no set, like it's not 5 times the amount, for example, for a fine or something like that. Each fine is assigned individually and based on what was actually done. All right. The next one, many of you may be familiar with, and it's called the Social Security Act. But this does have an exclusion statute. And inside the Social Security Act, there's an area that talks about criminal health care fraud statutes. These are prohibit knowingly and willfully executing or attempting to execute a scheme or lie in connection with development payment of healthcare benefits. This includes any federal programs. It's not just Medicare, again, federal program. Here's just some different things you can see. There's one example listed on the slide. So it's several providers who conspire a scheme to defraud Medicare by submitting claims for unnecessary power wheelchairs. This is one that has been prosecuted more than once and has actually been won more than once. Now, it didn't just go back. It says, okay, hey, you submitted this many claims. They shouldn't have been done. Here's how much money. Here's how much you owe us. All of that. By the way, as part of the referring, you are now excluded from receiving payment from Medicare as well because you referred for this. So there's a variety of different things that can happen with that exclusion portion. All right. Slide, sorry. So fines, imprisonments, all of those different things, both can happen. The exclusion statutes. These statutes are required by the OIG to exclude individuals or entities, healthcare providers and suppliers who are convicted of certain crimes for participation in the federal healthcare program. So the OIG has a specific list. When we're doing provider enrollment, we have to look at this list. I've asked Aline to place a link in the chat for you. What this list does is it tells us who's been excluded under any of these programs. Just because you have a conviction doesn't necessarily mean you're going to be automatically excluded from Medicare. Now, there are certain things that, yes, they will automatically exclude you. Okay? The program will not pay for items or services from these excluded providers. Also, they will not pay for ordered or prescribed services from these providers, and that makes a big difference. So this could be, can include Medicare fraud, patient abuse or neglect, felony convictions for other healthcare related fraud, theft, or other financial misconduct, and felony convictions of unlawful maintenance, distribution, prescription, or dispensing of controlled substances. One of the biggest ones people ask us about is patient abuse and neglect, and what does that mean? So sometimes we see this within a nursing home where the patient isn't properly being cared for, and that would be an example. The family then reports it and it is investigated, and it can fall underneath the exclusion statutes. So hopefully that does make sense and gives you an example of that. Civil Monetary Penalties Law, CMPL. This authorizes the OIG to seek civil monetary penalties and exclusions for healthcare fraud violations. Again, there's a variety of different reasons, but it may include up to 3 times the amount claimed for each item or service, and up to 3 times the amount remuneration offered, paid, solicited, or received. So it can be very costly. Violation, presenting a knowing claim for items or services not provided as a claim that is false or fraud. So you say, hey, we did this, and it wasn't there. You can violate the anti-kickback statutes, and then the OIG can be involved, and that's what this one will do with the civil monetary penalties. That's what it's talking about. It's part of that portion under the anti-kickbacks. Also, making false statements or misrepresentation on applications or contractors to participate in the federal program. So civil monetary penalties can apply when you do not complete the information on your Medicare provider enrollment application correctly. Therefore, you're issued payments that you should not have been issued. Should not have been issued. An example of this is a provider who said that they were state licensed and provided a state license. They did not maintain that state license for ambulance services. As they did not maintain it, because they got rid of the ambulance and went to a wheelchair van service, but kept, again, supplying information stating that they were state licensed and everything looked correct to Medicare. Later, it was found out that this is not correct, and the state license they were supplying was not an actual state license. So when they got all of that different information together, yes, they did commit fraud. They knowingly did this. It was misrepresentation. They did it through provider enrollment. The claims were not filed correctly. So a big old long trail leading to civil monetary penalties and some imprisonment time. Violating any of these laws can result, again, non-payment of claims. Well, that makes sense. We're not going to pay you for claims if we know that you're doing other things. Again, civil monetary penalties, we've talked about that. Exclusions, we've talked about that. But also criminal and civil liabilities and other penalties such as fines and imprisonment. All of these things can result in any of these law violation. Now, a case must be built and must be investigated before doing that. And that means that different players are involved. And that's what we'll talk about in the next section. Let's move on and just answer some questions based on these laws and see what we have going on. The first question I'd like to do is a pre-submitted, then we'll move to your ones that you just submitted. So who's responsible for fraud? Now, I'm going to answer this in the way that I think you meant, but if you didn't, please let me know. So who's responsible? It is the person being paid for the service. So if you receive money from Medicare, anything billed underneath you is considered fraud underneath you, unless you do not or were not in any way, shape, or form doing that. Now, that may mean that someone within your billing office is billing with your number, but you didn't even know that they had it. So you're getting payment for that. And before you even see that, they're taking money out of the systems and doing some different things like that. With that said, there could be other practices or organizations that can be using your number unknowingly to you. That could be a form of fraud, which you may not be responsible for. But the basic gist of it is who got the money and who received the money. If you as the provider are receiving the money, then you are committing fraud or abuse, or you can also be committing waste. With that said, Lean, do we have any questions in the chat?
Yes, we have gotten just a couple questions. The first one comes from Joyce, and she says, what is the time frame allowed to make an amendment to a patient record, and what are the laws supporting this?
So the laws that support the amendment itself are actually the Social Security Act, and it's supporting the medical necessity and accurately reporting within the medical records to avoid any of these other laws over here. So that's where that comes in. Now, what are the time frames? The time frame is not set. The time frame simply says, if you find it, make the amendment. And that way, if at any point in time someone comes back and goes through different things, what they will say is if you've been questioned on it or if something came up during that. So let's say that we requested medical records, and then based on that request, you went back and added amendments or you changed things based on what you now know. That could be considered actually abusive, moving into fraud territory. So there isn't a certain time frame that I've ever heard of, and I'm just going to ask Aline if she has any further input on that question.
Yes, when the question came in, I did run out and get a manual reference. And so the program integrity, which is 100-08 in chapter 3 and section 3.3.2.5, and I'll put this in the chat, talks about amendments, corrections, and delayed entries in medical records. And so this is something that you'll probably want to take a look at because we do regulations, but it's where it tells you that things should be added as soon as the service is provided. But I wanted to give a resource for you as well. And again, I'll put that reference in the chat for you.
Thanks, Aline. Anything else?
Yeah, our next question comes from Jennifer. This says, to meet various Medicare plan requirements, we use the CMS courses, and she listed the different courses for Medicare fraud and abuse that CMS has in the Medicare Learning Network. She says, do you know of any newer courses Or does WPS have any comparable courses that can be used?
So the courses that are typically designed for that, especially for the one for Part C and D, are required by CMS. No, we don't know of any newer courses. The course that we're giving is based on the questions that were asked of us. So we may meet some of the same information, but it's not as specific, or it's not meeting that requirement that CMS may use. So we really do recommend taking those CMS courses. I do understand they're a bit older. If you would like CMS to update those, feel free to write into your CMS regional office, give them the suggestion, and they may be able to take a look at those further. Any other
Yeah.
questions?
No more questions at this time.
Awesome. All right, next section. Sorry, I'm just frozen there. Okay, so players that are combating, and this rules section actually focuses on a lot of the different areas, which could be everything from a provider and a patient down to the different contractors and stuff like that. So what we really want to do is who's looking at these ways, who's using these laws, and what are they doing with them to really help do this. So remember, all of these players are in partnership with the federal government and the agencies. So state law agencies, law enforcement agencies, the Federal Bureau of Investigation, all of these work together to really look at saving this money because it is taxpayer funds. Again, I talked about the Federal Insurance Contributions Act. That's where you pay a big part for your Part A stuff. And then, the premiums that are paid in, well, these are your taxpayers. So again, start with federal government agencies and we'll work our way down through some of those different agencies. So obviously, the role starts with you. And how do you make sure that you're meeting these roles? Well, please make sure you know the rules regulations for the services that you bill. This starts to be very complex, as again, I said, you do need to look at the CMS website and make sure you're following all the information. 2, provide appropriate services. That means medically necessary, right? When you're then doing that, make sure the claims are coded and it is an appropriate claim, okay? Last, please keep complete and accurate documentation. I don't know how many times we've said this before and how many times we're going to say it again in the future. Complete and accurate documentation also includes signatures. Everything must be signed. Most things must be dated. The signature must be legible. If it's not legible, it doesn't count. If it's not dated, it's definitely not going to work. So we want to make sure everything is complete, accurate, and legible and meets all of the documentation requirements for whatever it is. You get to report to. First, the OIG online reporting system is there for you, and that's got a link right here. You can simply use that link and go out there. You could also call the hotline and report to them. You can contact us and we'll begin to look at certain things. And so we'll pull a few records and we'll kind of look through a variety of different things. Or you can mail your information to the Department of Health and Human Services, the Office of Inspector General. Remember, that's the OIG. And then you want to look at their attention hotline operations, and that gives their full address. The thing to remember is regardless of how you're reporting it, it's just most important to report it and to follow along with those statutes and give us the information that you need. Many people have found that reporting it anonymously is better for them. That's their choice. However, it's not always required, and you again can do a variety of different things if you choose to. A lot of people have asked us if a patient wants to report, what would they do? Well, they can start with 1-800-Medicare. That is a very common place for them. You can refer them to an OIG hotline, and that's fine, and we'll talk more about that. But starting with 1-800-Medicare is the normal place for a patient. Now, the reason that this is recommended is because the patient may not always know that it's something that is correct or wrong. And here's an example of that, and we talked about it earlier. The patient says, hey, I've never seen this provider. But that provider is the one who read their lab results, or that provider is the one who interpreted the x-ray or the MRI. Well, those readings and those reports are still needed, right? The patient may not recognize that. So that's why we always encourage them to go to 1-800-Medicare, kind of begin in that way before just automatically assuming. But they can report to anyone they want. Now, if they choose, the beneficiary can also report to the OIG. Again, they can use that online source, and there is that phone number, same one as before, or they can mail it in. It's up to them. Really, it's up to the patient. Now, if they're asking you, you can refer them wherever you want. That's up to you to decide what's best for your business practice. Working all of this together, Medicare does have a fraud strike I'm sorry, Medicare Fraud Strike Force. The Medicare Fraud Strike Force is comprised of the OIG and the Department of Justice. They have analysts, investigators, and prosecutors all working together. They target emerging or migrate, uh, migrating fraud schemes, which include fraud by criminals masquerading as healthcare providers and suppliers. One thing to remember with this is where you said they target this emerging or migrating. So it may be in a certain area as they begin, or they may move from area to area across the country in order to avoid getting caught. And that's why the fraud strike force is in place. That's where it comes from to help make sure that they're getting all across the board. The False Claims Act and whistleblowers information. So again, this is where we're going to look at that incentive for whistleblowers. They can receive up to 30% of the recovery. So again, they cannot, in this case, report anonymously. But if they choose to report, they give certain pieces of information, they can get some of that information. Whistleblowers can include anyone such as ex-business partners, staff, competitors, patients, spouses, other items like that, people with the knowledge or the know of what goes on. The federal law protects them from retaliation too. So just because there's a law in place doesn't mean it doesn't happen. This is why there's incentives for whistleblowers, and that is to receive that extra money or that employment area back. Okay. So some improper things. Whistleblowers often report on improper claims. And what is considered to be an improper claim? Well, whistleblowers normally start with not provided services. Just, hey, we didn't even do that one. How about not medically necessary services? Now remember, we talked about that under the Social Security Act, and we said Section 1862 A1A has to be medically necessary. Provide aids and others not qualified to perform the service. So they're doing maybe a home health care or some other services, and it's done by someone who does not meet the requirements. Excess duration or frequency, upcoding, and they didn't meet the definition of treatment. How about the incorrect level of service? These are all things that whistleblowers commonly report on. Healthcare fraud prevention partnership. It's just a private and public partnership, and they look at different things between all the state agencies, the law enforcement, all of it together to basically detect fraud and abuse and to make sure that everything is getting the money back that they need to, depending on this. This fosters a proactive approach to detect and prevent healthcare fraud through data and information sharing. What MS do? Sorry, that slide rolled right by there. CMS, again, is that federal agency under the Department of Health and Human Services that administers Medicare, Medicaid, state children's health, clinical laboratory improvement amendments, and others, healthcare-related programs. They have an area called the Center for Program Integrity, which promotes the integrity of Medicare through audits, policy reviews, maybe identifying and monitoring program vulnerabilities. Part of that program integrity is education, such as what we do today. So they overlook all those key stakeholders. With that, they do have different organizations that they work with, such as the accreditation organizations, Medicare beneficiary and caregivers, physicians, suppliers, and other healthcare providers. Then they have the state and law enforcement agencies. One of the biggest ones is the Office of Inspector General, and you may have heard this. They work with them. The OIG is actually under the Department of Health and Human Services and can look at any program underneath there. Then there's the Federal Bureau of Investigation, FBI, the Department of Justice, state Medicaid agencies, and the Medicare Fraud Control Units, or NFCU. We don't work with the Medicare Fraud Control Units as we don't have anything to do with Medicare. I'm sorry, Medicaid. I keep saying Medicare. Medicaid Fraud Control Units. To support these efforts, and again, they want to work together, CMS may partner with other different contractors, and they may have contractors look at certain things. So what other contractors could they partner with, or what are some that are sometimes contracted or sometimes worked with? First, the Comprehensive Error Rate Testing Program. This is the CERT contractor, and they actually do calculate the Medicare fee-for-service improper payment rate. By calculating this and looking to see where the improper payments are occurring, they can partner with other contractors to have them reviewed further, such as your Medicare Administrative Contractor, which is WPS. Our job is to process your claims, but also to make sure that we're paying them properly to the proper provider, for the proper patient, for the proper service, all of those types of things. Sometimes you're going to hear about the Recovery Audit Program or the Recovery Audit Contractor, the RAC. This is another type. They're targeting certain services and they're looking to make sure they were paid and information was done correctly to identify underpayments plus overpayments. Okay. UPICS, the Unified Program Integrity Contractor, that's literally what they do is investigate fraud and abuse, their job. So they get a referral from someone, they now are a single point of contact, they begin to investigate Medicare and Medicaid fraud and abuse, they put a case together, they may refer it to a law enforcement agency, they may be able to get the changes done, all of those different types of things. One of the contractors that we were asked about that is not on this slide is the Supplemental Medical Review Contractor, or SMRC. Yes, they're another contractor from the federal government, and I will tell you, they are what I like to term special projects. So there's no specific given thing set up for them. They'll work on whatever the federal government tells them to. So usually the Center for Medicare and Medicaid Services tells them to work on something. So it's SMRC, or Supplement Medical Review Contractor. I have talked about this one a lot. This is the Office of Inspector General, and their goal is to be the legal watchdog under the Department of Health and Human Services for any of those programs. So they do a variety of different things, including a work plan each year. HEAT. HEAT is the Healthcare Fraud Prevention and Abuse Action or Team. Again, this is just all of these different agencies coming together to work together to prevent fraud and abuse. And then they develop a task force or a team to do that. That's what it is. General Services Administration. The GSA solicits several federal procurement systems into one system. The system for the award management. This system includes information on entities that are debarred, disqualified, all of those other exclusions and things like that. So the SAM, the System of Award Management, just makes sure that everything is being done properly. And once you do have a conviction against you, it kind of goes through some of that. Oops, that brings us to our last set of questions, and I'll run through just a couple really quick. So how does WPS actively look for fraud, waste, and abuse? The first one that we do is what's called Medical Review Targeted Probe and Educate. What this is it looks at areas that are vulnerabilities within the Medicare system, and then it looks at the providers who are actually causing these areas. So that is where we talk about with Targeted Probe and Educate, and it is very much targeted. We do a claim sample, we then do medical review for them, we then give them the results, etc. Some are released and some are not. We also do fraud, waste, and abuse education on top denials. So this is a data-driven program that we do with that. And again, it's just looking at the top denials and how can we avoid those. Does Medicare ever request a copy of an internal audit? Now, I can't answer this for Medicare on an overall basis, and I want that clear. What I can say is WPS does not. Is there no waste and the whole medication is given? This is very specific to using a JZ modifier. Is it not, the claim will automatically be denied. So there's no waste, you're billing the medication, so it's all given. You don't have a JZ modifier because there is no waste. Will the claim automatically be denied? The answer is no, not under this situation. I do want you to keep in mind that there are other things that could cause this denial. I know we're right at time, but I just want to check with Aline and see if we have any more questions that I need to answer.
No additional questions at this time.
Okay, let's go ahead and just finish up here then, people. Here we go. We want to let you know that our interactive voice response system eligibility feature will be continued as of January 1st, 2025. Not discontinuing any of our other resources that are here, but if you want more information, I do recommend checking out the change request 13754. This is a pilot program or a demonstration program. CMS will evaluate this again later to see if they want to discontinue that use or if they want to reinstate that use. One of the focuses coming from CMS is called health equity, which is achieving the highest level of care for everybody, right? So if you want more information in health equity, take a look at that website. But remember, it really is about achieving everyone at their highest level of care. If you need a proof of attendance certificate, so we do not issue CEUs, we do issue you a proof of attendance. What'll happen is you're going to get an email coming in just a few minutes. The email will contain the certificate of achievement. It's down on the bottom. Save this email. This is your certificate. It will also give you a link to the survey. We'll talk about that. The email does have your contact hours, and that's what this is going to be based on. Now, again, we don't issue CEUs. That is up to the governing body to accept those or not accept those. So you'll have to ask more questions of them and how to submit for them. Follow-up questions. I'm going to give you 7 days. It's 12-3. Follow-up questions by 12-3. Now, here's what I want you to keep in mind. I know on this slide it says today's topic. That's fraud, waste, and abuse. Please don't put today's topic in there. Put fraud, waste, and abuse in there. When we look at this, please email us. It's wps.gha.education@wpsic.com, and we'll take those if we can. Please remember, if it's something very specific to a claim, we can't help you. You do have to refer that to customer service. Again, here we go with that survey. I'd really like to hear from you on what you think I did well, what you think I needed to improve on, what my slides look like. Were there other research that you think would have been useful? Did the information that Aline put in chat help you? Any of that. We really want to know what you think. I'll take a couple of minutes, give us that feedback by completing the survey. You can use the link provided in the chat. You can do it right now. You can wait, and we're going to give you a pop-up box. It's going to look like the lower right picture. And that will happen just after that, or also you can use the link that will be provided in the email that's going to come out to you. Which finally brings me to the end. Thank you. Thanks for your time today. We know that we're all busy, and we do appreciate you taking the time to attend this. We would really appreciate, though, if you would give us the feedback. Remember to give us what we can do better, what we can do, what you liked, what we did. Also, include those topics. Doesn't have to relate to fraud, waste, and abuse. Can be any topic. On behalf of myself, Aline, all of Provider Outreach Education, and all of WPS, we'd really like to thank you for participating. Y'all have a great day, and you may now disconnect.